Vata Kasa means cough produced by vitiated Vata Dosh. It is one among the 5 types of cough. Due to the impact of Vata, the cough is dry in nature with absence of or less expectoration of phlegm. This condition is associated with pain in the chest. Causative factors: excessive consumption of dry foods, excessive consumption of cold foods, excessive consumption of foods with predominantly astringent taste, consuming less food, consuming food in limited way, not consuming food at all or starvation, excessive indulgence in sexual activities, forcibly withholding the natural urges, excessive indulgence of strenuous exercises or activities, etc. Signs and symptoms of cough: dry cough, dry phlegm is expectorated. The phlegm is expectorated with difficulty after repeated coughing. Phlegm is less in quantity. Absence of sound when the person coughs. Hollow and groaning cough. Pain in heart, flanks and chest. Dryness of chest. Irritation in the chest. Weakness of voice. Hoarseness of voice. Headache, pain in the temples, dryness in mouth and throat, horripilation, physical weakness, abdominal pain, tired and lusterless face, deterioration of ojas or immunity, loss of consciousness, misery, delusion, etc. Pacifying factors: cough gets pacified by foods and liquids which are unctuous, sour, salty and hot in nature. The people in whom the Vata gets aggravated and moves upward after the digestion of food, the bouts of cough are severe. Treatment of Vata cough. Number 1. Snehan or oleation therapy. Oleation therapy should be first administered in Vata type of cough to the person whose body has become dry due to vitiation of Vata dosh. Like ghee, enema, gruel, soup, milk, meat soup should be administered prepared with Vata alleviating herbs. 1 or more of this shall be used in the form of unctuous smoking, confection, massage or anointing, showering, etc. Number 2. Svedhan or sudation therapy. When the person is properly lubricated with the fats used in above said forms, he should be administered with sudation therapies. Number 3. Anuvasan basti or fat enema. Medicated fats administered in the form of lubricating enema for constipation and when feces and fart are not voided properly in spite of above therapies. Number 4. Oral use of medicinal fats after food. In the patients having dryness in the upper portion of the body associated with pitta, ghee should be given for oral consumption after the patient has finished taking food. Here, dryness in the upper portion of the body, like chest, should be considered as having dry cough. So, In dry cough associated with pith, medicated ghee should be given after food. Number 5. Sneh Virechan or unctuous purgation. Similarly, in case of dry cough or dryness in the upper portion of the body associated with cough dosh, purgation should be given with unctuous formulations. Unctuous purgation formulations means oils or ghee prepared with purgative herbs. Ready-made Ayurvedic formulations for Vatach cough. Kantkari ghee. It is a good appetizer, kindles digestive power and cures dry cough. Pipalyadi ghee. It is very useful for almost all chest conditions including cough, dyspnea or asthma, morbidity in heart and flanks. Trayushnadi ghee. Apart from cough, it cures fever, pain in the head, heart and flanks, restlessness, spleen enlargement, jaundice and emaciation. Rasnadi ghee. This is said to cure all the 5 types of cough and can be used in the form of nasal drops, oral consumption and enema. Yavakshāradi Churna, Karkat Shringi Churna, powder of Bharangi or Clerodendron serratum and ginger mixed with hot water can cure dry cough. Avle or lay or confections. Durlabhadi lay, Dusparshadi lay, Vidangadi lay, etc. Agastya Haritaki, a herbal jam widely used to cure dry cough. Apart from wide array of disorders, it is used to cure 5 types of cough. Dhumpan or medicated smoking. If the patient of cough or rhinitis also has headache, nasal discharge and heaviness in the chest, he should undergo medicated smoking. Like Manashiladi wicks are used for dhumpan or medicated smoking. Wholesome diet for cough. Rice, barley, wheat and rice grown in 60 days should be included in the diet and should be consumed with one among the meat juice of animals living in marshy regions or water. Soup of black gram, radish, use of sesame seed and other similar oils for lubrication, milk, sugarcane juice and eatables prepared using jaggery, curds, sour fermented gruel, sour fruits and juices, supernatant part of wine, food substances predominant in sweet, sour and salt tests, etc. Hope this information brings health in your life. Thank you.